In this video, we will talk about the arteries of the upper limb, their origin, course through the body, and their branches. What are the major arteries of the upper limb? The primary arteries supplying the upper limb include the subclavian artery, the axillary artery, the brachial artery, the radial artery, and the ulnar artery. We will begin with the subclavian artery. Origin: the right subclavian artery originates from the brachiocephalic trunk, while the left subclavian artery arises directly from the aortic arch. Course: it travels laterally under the clavicle, becoming the axillary artery, at the lateral border of the first rib. Branches of subclavian artery: it gives 4 branches. Vertebral artery supplies the posterior part of the brain. Internal thoracic artery supplies the anterior chest wall and breasts. Thyrocervical trunk gives off several branches, including the inferior thyroid artery, transverse cervical artery, and suprascapular artery. Costocervical trunk supplies the deep neck muscles and the first 2 intercostal spaces. Number 2. The axillary artery. Origin: it is the continuation of the subclavian artery, at the lateral border of the first rib. Course: it travels through the axilla, becoming the brachial artery, at the inferior border of the teres major muscle. Division into 3 parts. The axillary artery is divided into 3 parts, based on its position, relative to the pectoralis minor muscle. First part, proximal to muscle. Second part, deep to muscle. Third part, distal to muscle. First part of axillary artery: it gives 1 branch, superior thoracic artery. Second part, it gives 2 branches, thoracoacromial artery, lateral thoracic artery. Third part, it gives 3 branches, subscapular artery, anterior circumflex humeral artery, posterior circumflex humeral artery. Number 3. The brachial artery. Origin: it is the continuation of the axillary artery, at the inferior border of the teres major muscle. Course: it travels down the medial aspect of the arm, entering the cubital fossa at the elbow. Branches of brachial artery: profunda brachii. Deep brachial artery supplies the posterior compartment of the arm. Nutrient artery to the humerus supplies the humerus. Superior ulnar collateral artery runs with the ulnar nerve, supplies the elbow joint. Inferior ulnar collateral artery supplies the elbow joint. Number 4. Radial artery. Origin: begins at the bifurcation of the brachial artery, in the cubital fossa. Course: travels down the lateral aspect of the forearm, passes through the anatomical snuff box, and enters the hand. Branches of the radial artery. Radial recurrent artery supplies the elbow joint. Palmar carpal branch supplies the carpal bones and joints. Superficial palmar branch contributes to the superficial palmar arch. Deep palmar arch supplies the deep structures of the hand. Number 5. Ulnar artery. Origin: it begins at the bifurcation of the brachial artery in the cubital fossa. Course: it travels down the medial aspect of the forearm, enters the hand through the Guyana canal. Branches of ulnar artery. Ulnar recurrent arteries, anterior and posterior, supply the elbow joint. Common interosseous artery divides into anterior and posterior interosseous arteries, supplying the forearm. Palmar carpal branch supplies the carpal bones and joints. Superficial palmar arch supplies the superficial structures of the hand. Deep palmar branch contributes to the deep palmar arch.